Good afternoon. Today is October 6, 2013, and I'm here to talk with you about the impact of the Obamacare on current issues regarding access of health care for college and graduate students, access of health care for young families, access of health care for teachers, and the increased cost of premiums, as well as the effect of the Obamacare on early childhood center learning, as well as the effect of the Obamacare on current issues such as lack of funding and reduced funding for Title I and special education funding as it pertains to district level budgets. The implementation of the Affordable Care Act as part of the Obamacare initiative set forth in 2010 is finally coming to fruition. One of the hottest educational trends is the impact of the Obamacare programs on all levels of education. If you took the average graduate student, 27, that currently is underemployed or out of work, might attend college, might live with a family member, currently, if they make $7 an hour and have an income below the poverty level of $14,000, they will have to pay an annual premium of $288 or face a penalty tax that will be later taken out of a tax refund or lien on their wages. And this information can be found on thinkprogress.com. Why am I sharing this information with you, and why do I feel that it pertains to the field of education? The Obamacare Act is currently having a devastating effect on students in college. Prior to the implementation of the Obamacare Act, college students could purchase affordable premiums, but now are facing healthcare premiums that they cannot afford. Is this fair to the college student or graduate student who is trying to obtain an education? They're suffering the rising costs of public school education at the secondary level, and simultaneously they're going to face the rising costs of healthcare insurance premiums. Needless to say, I've always been blessed with health insurance through my parents' insurance premiums, but through research I discovered that many college students do not have access to health care through their family, whether their family members are utilizing Medicare insurance or whether or not they are utilizing Medicaid and or possibly are underinsured. These college students and graduate students have to purchase self-insurance plans that used to be affordable, but based on the implementation of the Obamacare Act and the Healthcare Reform Act will no longer be affordable. Actuaries estimate that benefits are actually going to increase premiums for those ages 18 to 24 by 45%. So let's take the average cost of healthcare for an individual plan, and let's say it's about $150 a month. $150 a month times an additional 145% would actually equal to roughly $60 to $75 additional a month, okay? So if we took a $150 plan and we added $60 to $75, that's now going to create a plan that's going to cost $225 a month. But $75 is a lot of money for the average college student monthly that may be attending school full-time and may have a part-time job and may not have the access to funding to pay the increased premium. Therefore, they will be forced to either choose paying for food, buying textbooks, paying for gas for their car, or buying health insurance. And ultimately, they will have to purchase the required health care plans that are going to be available at the statewide level through a cafeteria election plan. It will not ultimately immediately affect me, as I am in a family of 4. I have 2 small children. My husband has insurance through his own insurance provider. I have insurance through my insurance provider. However, according to a recent article published by Forbes, Obamacare will add $7,450 to average healthcare spending for a family of 4 between 2014 and 2022. So within 8 years, I will have to roughly spend about $900 to $1,000 additional money after taxes to pay for additional healthcare premiums. Currently, I have an average salary of about $40,000 annually. My husband has an annual salary of take home roughly about $40,000. So if we make $80,000 together and after take home and taxes we take home $60,000, then roughly we are going to see an effect monthly to our $1,000. We are going to lose roughly $100 out of our family budget every month. $100 may not seem like a lot of money in today's economy, but $100 can buy a week's worth of groceries. $100 can buy 2 weeks worth of gas. $100 can pay for a medical procedure. $100 can pay for 4 copays to see the doctor. So I estimate that families that will be affected by this increased premium will have to make life choices where they will have to reduce their spending in terms of their quality of life spending, in terms of their family budget spending. I believe that it's going to create a financial strain on the average middle class family. The Obamacare Act affects all levels of education, from the college student, graduate student, and a small family of 4 to early childhood education. I know that you have heard that due to the government shutdowns that there have been many Head Starts and WIC programs that have closed, as well as access to Social Security disability for families of children with disabilities. Currently, over 50 Head Start programs have had to close due to the government shutdowns. Once these Head Start programs will start up again, there will be a initiated process of re-entry into those programs, which will create a lag or delay in access to families for quality health care, quality child care, and quality preschool programs for families of underprivileged children. In addition, the lack of access to WIC programs is going to increase the issues surrounding malnutrition and lack of financial resources for families that depend, especially families like myself that have young children but do not have access to adequate funding to pay for things like formula and milk and cheese and other products that are available through the WIC program. Currently, they do not have access to this funding, and this is going to have a short-term and possible long-term effect in the nutrition of these families. The stalemate between Congress and Barack Obama has created quite a bit of suffering for the American people. Head Start programs are going to constantly close due to this issue, and unfortunately, Obama, of course, had this wonderful, lofty idea about this Preschool for All initiative, as well as increased funding for WIC programs and other programs. However, even a temporary closure for a few months will have a devastating effect on the previous government efforts to provide better early childhood care education and access to nutritional programs that are currently publicly funded and monitored to reduce childhood hunger and provide adequate child care services for families that are low income. Another educational trend that is impacted by the effects of Obamacare is access to public school funding for special education and Title I funding. Currently, school districts across the country are digging through details of how the Affordable Care Act is going to affect their budgets starting in January 1st, 2014. And as we know, school districts, when they have a cut in funding, they're going to cut school employees, they're going to cut programs, they're going to cut salaries. At my current position with the Nevada Virtual Academy, our school fired 2 employees that were performing at the lowest levels, and they were both math high school teachers. I know that there will be more cuts in January 1st, 2014, and luckily I am a special educator with a dual certification in visual impairment studies as well as a generalist certification and elementary education certification. But I feel badly for the general education teachers that will be at the mercy of the cuts. The teacher unions here in Clark County, Nevada will certainly be in a job, as I anticipate increased enrollment membership due to people's general fear of losing jobs, their desire to advocate at the grassroots level, to encourage communication between local school districts, as well as their communication with the with governmental levels at the federal and the state levels of departments of education. The rural school districts will have the most immediate effect, as rural school districts with less than 50 employees will now be forced to provide healthcare options that will be immediately affected by the Obamacare initiatives. We should all be optimistic that healthcare and WIC programs will reopen to the public soon. But pray to God that you aren't a parent of a child with a disability that can currently not apply for Social Security disability until the government reopens its doors for business. And as we know, when you apply for Social Security disability benefits, there's usually a lag of 6 months to a calendar year. But note that Head Starts are already facing cutbacks due to sequestering budget cuts and have limited services for 57,000 children this year. Sequestral budget cuts were originated from the original government efforts to reduce trillions of dollars that we owe in debt, not millions, but trillions. According to national statistics, over 1,800 Head Start programs could close this year. How can school administrators take an effort? I think it's pertinent to educate teachers before a widespread panic happens, which might have already occurred because I feel panicked. It's important to offer school employees education to understand the implication of education and personal health care effects of the Obamacare. There's a website that has some helpful information to learn about the impact of Obamacare Act as it pertains to an individual health care membership or family care health care membership. It's called thinkprogress.org. It may be also very helpful to engage pay for performance programs to encourage higher level of work output and results of students, to encourage staff to maintain their employment status and encourage excellence to protect their own jobs. It's sad, but the reality is that school administrators are going to have to let go of staff, and we're all going to have to justify our jobs, just as the business industry has done all along. This is Jennifer Ding, special education teacher, Masters of Special Education teacher candidate, saying, I hope you have a wonderful day, and I hope that you've learned a lot of helpful information about the impact of the Obamacare initiatives on all levels of education.